Well, daily COVID-19 cases in South Africa have increased, with over 4,000 recorded in the last 24-hour cycle. The Health Department also reporting 53 more COVID-19 related deaths. Active cases have risen to over 39,000. The number of vaccines administered so far is 642,946. Well, schools in the Northern Cape have recorded around 160 new positive cases over the past week. The Northern Cape Education Department says these include educators, learners and support staff. The Northern Cape has seen a sporadic increase in cases in recent weeks. Gauteng, the Free State and the Eastern Cape are currently experiencing a third wave, with fears that the whole country might follow suit. To discuss, we're joined now via Zoom by Educators Union of South Africa's National Media Executive, Bruyn. Mr. Bruyn, thank you for being with us. So what is the situation and what does that mean for you in terms of keeping schools open or closed or interventions at the moment?
Thank you so much for having me and Educators Union on your show. Educators Union just feel that schools are not adequately prepared for another wave. And over 2,000 teachers died in the previous wave. So, we just feel that we, especially your poorer schools, are not adequately prepared to have another wave. And we're not the only union to feel like that. About 20 days ago, our colleagues at NAPTOSA also said that exactly the same thing, that we are not adequately prepared. Most schools are not adequately prepared to face the third wave.
So you want another wholesale closure of schools?
Our immediate goal is to flatten the curve, especially where there are hotspots. Let's call it hotspots. You see, you've also now mentioned the lot of infections, especially in the Northern Cape and in the Free State, Limpopo, Eastern Cape. So we need to flatten that curve and have a break in transmission, at least at school level, because if we look at the positivity ratio at this stage is almost 10, is especially alarming because socially people are not following the rules anymore. So it is impossible for schools to be able to curb child-to-child infection as well as child-to-adult infection. So we just feel that, especially in the areas where you have high infection rates, that we need to close the schools now to just, it does not need to be a lengthy period, it just needs to be till we've just made a dent in the upward curve of this infection rate.
Yeah. What about the research that suggests that children don't easily transmit the virus, they don't get it badly, and the long-term effects of not schooling children are going to be dire? There's already been a setback. We know it's increased inequality between the private schools and the government schools. And you even have kids who are not getting fed because they're no longer at school, where at least they can receive that nutritious meal, even if it's once per day.
Yeah, in the previous wave, school feeding schemes were operating though the schools were closed. And the loss of learning is not the same as the loss of life. I know of a principal, my ex-principal, who died from COVID. He got sick 5 days after the school closed, and he's not with us anymore. So we have a little bit of a problem also, that the evidence there's not enough evidence to show that the infections are not done through child to child and then child to adult. And the absence of evidence is not evidence that something is not there. So I don't believe that the evidence is sufficient to tell me, because there has not been effective testing, effective tracing, effective tracking of every school child in this country to tell me that there has not been, or school children does not impact the increase of the curve.
But health experts are looking at the overall stats, and even I think before the last closure was saying it does not justify the closure of schools where learning is essential.
Yeah, and we are dealing with a novice virus. It's a new virus. We don't have past, how can I say, past stats. I mean, we have stats like in 1918 and 1919 with the Spanish flu, the closing of schools definitely stopped the spreading of it. And I can go on 2009, the N1H1 virus, the closing of school stopped 25 to 50% of infections just by closing the school. So it's okay to say that schools must be open, but we're not saying learning must stop. We're not saying education must stop. We can still educate like we have been doing. Why are these so-called fundis not telling us or not engaging the department on getting all kids up to speed in online education where every child in this country can engage and have contact with their teachers on an online platform?
Yeah.
Why is that not done? We are in the third wave, and what has been done to equalize the inequalities that is existing in our education system?
Well, is that really viable before the third wave peaks, given that government in various provinces has been trying to furnish school kids with iPads, with technology for years?
I know about the attempt to do that, yes. But in reality, you have huge shortfalls, especially in the poorer areas, and we have our statistics to prove that. It's huge shortfalls, and it's difficult for poorer kids to go into your schooling where you already have overcrowding. You already have. Just imagine yourself being a teacher and being in front of an overcrowded classroom, and knowing that in front of you may have one or two positive cases, but it is not picked up by screening and scanning, and you sit with comorbidities. So just imagine the anxiety that teacher has, because teachers with comorbidities are at school.
Yeah. Well, as I understand, Mr. De Bruyn, there were exceptions for teachers with comorbidities, even right from the start. So maybe that's not the best example, and there was provisions for some teachers to stay at home. Before we let you go, though, tell me what's the second best, because government is facing a third wave, infections going up, looking at what to do. Is the rotational rosters where you try and achieve social distancing and things like that, kids at school some days, not at school other days, is that working at all?
You see, there's also, let me call it, two types of criteria for different schools in this country. You have some schools, I'm not going to say which schools, that are back at full capacity, engaged in full contact sports and everything, and that is where most of the infections took place. And then you have the majority of schools who are still following the rotational basis, one day on and one day off. But on the off days, the children do still get an education. They still are engaged by the teachers, even if it's on a simple platform like WhatsApp. The teacher still provides the children with work, even though they are not at school. So the next day when they are at school again, the teacher can monitor that and engage the children further so that learning can take place even furthermore. So the rotational basis is working at this stage because the numbers in classes are a bit smaller, but I can tell you of schools where they have been allowed by the Department of Basic Education to be at full capacity. And I know of a school that's not even scanning anymore. They're not doing anything like that. The kids must also sanitize themselves before they go into classrooms. And these are schools that engage in full sport participation. So, I mean, why does DBE allow some schools to do and others must follow protocol as put forward by the Department of Basic Education?
All right, we'll see if we can get a response to that at some stage. That was Andre de Bruyn, the Educators Union of South Africa's National Media Executive. Thank you very much. We'll take a short break.